So the objectives of this meeting are as follows. So we'll look at the median nerve and its branches on the hand. We'll look at the ulnar nerve and its branches. We'll look at the cutaneous innervation of the skin of the hand. We'll look at the palmar arches. So the palmar arches is basically like the blood supply to the hand, and it's made up of the radial and ulnar artery. Then lastly, we'll look at the dorsal venous arc, like the venous drainage of the hand. Okay, so these are the objectives for today's session. So let's begin with the median nerve. So right here, so this is the median nerve, but I would like to pick it up like from the from where it's coming from, like from the brachial plexus, right? So we all know the median nerve is coming from the brachial plexus. So that yellow thing is the median nerve, and it originates from two branches, one coming from the lateral cord and the other one coming from the medial cord. So those two branches, they unite to form the median nerve. So when the median nerve is exiting the axilla, as you can see, it will first be lateral to the brachial artery. As you can see, it's lateral to the brachial artery. Then as it is going down, it will cross the brachial artery on the anterior aspect. Actually, it's the only thing that crosses the brachial artery on the anterior aspect to go medial. Okay. Then it will enter the cubital fossa. On the cubital fossa, the median nerve is medial to the structures, to the contents of the cubital fossa. As you
How may I help you?
have the median nerve, you have the brachial artery, you have the tendon of the biceps brachii, you have the radial nerve
Close the door.
on the far end there. So the median nerve goes to the forearm by passing through the two heads of the pronator teres muscle. So here you have the pronator teres muscle. So for it to go to the forearm, it will pass in between the two heads of the pronator teres muscle. Okay. So basically, that's a brief introduction on the median nerve. You've done this already. I'm just reminding you guys. So I want to pick it up from here. So when the median nerve passes in between the two heads of the pronator teres, it will be in between the flexor digitorum superficialis and the flexor digitorum profundus. Then it will be sending branches. As you all know, the median nerve is the main nerve supply to the anterior forearm. It supplies 6.5 muscles out of the 8 muscles. Okay? And the biggest branch of the median nerve is the anterior interosseous nerve. So after supplying the muscles of the forearm, this is the median nerve now, going to the hand. Okay. So as the median nerve is approaching the wrist, or as it is approaching the carpal tunnel, so you have the carpal tunnel there, okay, formed by the carpal bones down, and the roof of the carpal tunnel is formed by that whitish thing, the flexor retinaculum, which forms the roof of the carpal tunnel. So as the median nerve is approaching the carpal tunnel, it will give off that branch that will run superficial to the flexor retinaculum. So that branch is known as the palmar branch of the median nerve. And that palmar branch of the median nerve will basically supply the skin at the wrist joint there and the skin of the palm. Okay. So the skin of the palm and the skin of the wrist joint is supplied by the palmar branch of the median nerve before it goes into the carpal tunnel, as you can see. So after giving off that branch, the median nerve will enter the carpal tunnel. So it's one of the contents of the carpal tunnel. And as soon as it is exiting the carpal tunnel, it will give off that first branch, number 4, which is going to supply these 3 muscles of the thenar eminence. Okay, so that branch is known as the recurrent branch of the median nerve. So the recurrent branch of the median nerve is basically going to supply the 3 thenar muscles, which are the abductor pollicis brevis, which is number 3. Then you're going to have the flexor pollicis brevis, number 2. And deep to these 2 muscles, you have the opponens pollicis. So those are the 3 thinner muscles supplied by the median nerve. To be specific, they are supplied by the recurrent branch of the median nerve. Then after that, the median nerve is going to send off these branches. So these branches are known as the common palmar digital nerves. So these are the common palmar digital nerves. There's one, there's two, three, and the other one going to the thumb. So these are the common palmar digital nerves. And from the common palmar digital nerves, they further divide to form these terminal nerves. So these terminal nerves are known as the proper palmar digital nerves. So the proper palmar digital nerves are going to run all the way and of the digits. Okay, and the median nerve basically supplies the skin of the thumb, the index finger, the middle finger, and the lateral half of the ring finger. Or if you want the lateral half of the 4-digit, as you can see, it's only sending one branch. The other part is supplied by the outer nerve. We'll look at that later. So apart from supplying the three thinner muscles, the median nerve also supplies the first and second lumbricoid muscles. As you can see from the common palmar digital nerve, there's a branch going to the first lumbricoid muscle, and again from the second common palmar digital nerve, there's a branch going to the what? To the second lumbricoid muscle. Okay, so the median nerve supplies basically 5 muscles on the hand, and those 5 muscles are the first and second lumbricoid muscles and the 3 thinner muscles. The remaining muscles are supplied by the ulnar nerve. The ulnar nerve is the main nerve supply to the hand. Okay. So basically, that's the course of the median nerve. So there's a condition that occurs when the median nerve is compressed at the carpal tunnel there. So imagine these tendons, the tendons which are part of the content of the carpal tunnel, become inflamed. And when they become inflamed, like they can compress the median nerve. So that condition is known as carpal tunnel syndrome. Okay. So carpal tunnel syndrome occurs due to compression of the median nerve at the carpal tunnel. And the condition, it will manifest as ape hand. So there's a condition known as ape hand. You should read more on it. Ape hand and sign of benediction. So these two conditions occur when the median nerve has been damaged. So we all know the median nerve is supplying the muscles of the thinner eminence. So if the median nerve has been damaged, then those muscles won't be innervated. And when a muscle is not innervated, they begin to shrink. Okay, so that becomes a problem. So basically, that's all about the median nerve. So we can go to our next nerve, which is the ulnar nerve. So it comes to the ulnar nerve. The ulnar nerve originates from the what? The medial cord of the brachial plexus. Okay. The ulnar nerve on the forearm, it only supplies 1.5 muscle. It will supply the medial half of the flexor digitorum profundus, and it will also supply the flexor carpi ulnaris muscle. Okay. Then it won't send any branch to the what? To the forearm. Then the ulnar nerve is accompanied by this artery here, the ulnar artery. So these two, they'll be running together like that. And the ulnar nerve passes superficial to the flexor retinaculum. Okay, so it passes superficial to the flexor retinaculum. It will divide into 2 terminal branches. There's that branch there, number 2, the biggest branch going deep to the muscles. So that branch is known as the deep branch of the ulnar nerve. It is the one that will basically supply almost all the remaining muscles except for those supplied by the median nerve. Okay. Then there's that other branch there, the superficial branch of the ulnar nerve. So the superficial branch of the ulnar nerve only innervates one muscle, the palmaris brevis. Then it will supply the skin of the little finger and the medial half of the fourth digit. Okay? So that's the superficial branch and the deep branch of the ulnar nerve. So when the ulnar nerve has been damaged, the condition is known as claw hand. Okay? You should read more on that as well. So we can go to the ulnar artery. So those are the nerves, the median nerve, ulnar nerve. So basically, the nerve supply to the muscles of the hand is via those two nerves. The median nerve supplying only 5 muscles, and the ulnar nerve supplying the remaining muscles. For the skin, I'll talk about it again more. So let's look at the ulnar artery. So when it comes to the ulnar artery, we all know it is. So when it comes to the ulnar artery, I can go back to this diagram. So you have the brachial artery there. The brachial artery is a continuation of the axillary artery, and the axillary artery is a continuation of the subclavian artery. The subclavian artery is coming from the aorta. So in short, you have the subclavian artery. When the subclavian artery crosses the lateral border of the first rib, the name changes to the axillary artery. And when the axillary artery crosses the lower border of the teres major muscle, the name changes to the brachial artery. So this is the brachial artery there. So that brachial artery at the cubital fossa there divided into two terminal arteries, the radial artery and the ulnar artery. So the ulnar artery is the one that is going to accompany the ulnar nerve. So now we are going to look at this ulnar artery and how it supplies blood to the hands. So this is the ulnar artery here, as you can see. So the ulnar artery passes superficial to the flexor retinaculum. Then it's going to give off that branch that will accompany the branch of the ulnar nerve. So that branch from the artery is also going to be known as the deep branch of the ulnar artery. So the deep branch of the ulnar artery accompanies the deep branch of the ulnar nerve. Okay, so they are going to supply basically the deeper layer structures. Then the ulnar artery is going to continue as the superficial palmar arch. Okay, so that superficial palmar arch basically is going to be formed by the ulnar artery, although it is going to anastomose with a branch from the radial artery. We'll talk about that later. Okay, so you have that arch there that is formed basically from the ulnar artery. So from the superficial palmar arch, you have those 3 branches arising from it. So those branches are known as the palmar digital arteries, or the common palmar digital arteries. Then from the common palmar digital arteries, they are going to further divide to form those terminal arteries known as the proper palmar digital arteries. Okay, so the proper palmar digital arteries are going to supply basically the digits. Okay, so there are 3 common palmar digital arteries, and from the common palmar digital arteries, you have the proper palmar digital arteries. Then you have that one branch arising direct from the superficial palmar arch. So that branch is known as the proper digital artery, going to the medial aspect of the little finger, as you can see. So it supplies blood to the medial aspect of the little finger. The branch is coming direct from the superficial palmar arch. Okay. Then on the lateral aspect of the superficial palmar arch, this artery anastomoses with the branch coming from the radio artery. So this is the radio artery. The radio artery gives off that branch that will anastomose with the superficial palmar arch. So that branch is known as the superficial branch of the radio artery. Okay, so the superficial branch of the radio artery is going to anastomose with the superficial palmar arch. So basically, that's the ulnar artery on the hand. Okay. So let's look at the radio artery. So when it comes to the radio artery, let me mute everyone. Okay. So let me talk about the radio artery. So when it comes to the radio artery, it is also coming from the brachial artery, as you can see, as you saw previously. So the radio artery runs on the lateral aspect of the anterior forearm, or you can say it runs lateral to the tendon of the flexor carpi radialis. So that is the radio artery, as you can see. Then as the radio artery is approaching the wrist joint, it will run backwards. It will more like go to the dorsal aspect of the hand. Okay. So, but before it goes to the dorsal aspect of the hand, it's going to give off that branch that anastomoses with the superficial palmar arch. So this branch there, let me just draw. So this branch, the superficial branch of the radio artery, basically anastomoses with a branch. So this is the superficial branch of the radio artery. It will anastomose with this branch. So this is the ulnar artery, and we say the ulnar artery will continue as the superficial palmar arch. Then the superficial palmar arch anastomoses with the superficial branch from the radio artery, like that. Okay. So before the radio artery goes to the dorsal aspect, it will give off that branch. Then when the radio artery goes to the dorsal aspect, it will go backwards to the anatomical snuff box. So you have the anatomical snuff box on the dorsal aspect there. And the radio artery is one of the contents of the anatomical snuff box. The other content of the anatomical snuff box is the cephalic vein. Okay. So when it passes through the anatomical snuff box, what the radio artery will do is that it will pass in between the two heads of the first dorsal interosseous muscle. So there's this muscle you can see here. So this is the first dorsal interosseous muscle. The fibers are running like that. Then there are other fibers running in that direction like that. Okay. So all interosseous muscles are bipinnate. By bipinnate, like the fibers run in opposite directions. As you can see, even this one, there are fibers running in that direction, and there are fibers running in that direction. So all interosseous muscles are bipinnate. So what will happen is that when the radio artery goes to the dorsal aspect of the hand, it will pass through the anatomical snuff box. Then it will pass in between the two heads of the first dorsal interosseous muscle to appear on the palmar aspect again. So it will go to the posterior aspect, then it will pass in between the two heads of the dorsal interosseous muscle, then it will come back to the palmar aspect. So it will be deep on the hand there. So when you look at when the radio artery comes to the palmar aspect, it will give off the first branch. So I can put it in black. So it will give off that first branch. So that's a radio artery. It will give off that first branch. That will go to supply the thumb in short. So that branch is known as princeps pollicis artery. So this one here, princeps pollicis artery. So it will basically supply blood to the thumb. Then the radio artery is going to give off second branch, this branch here, that is going to go to the index finger. or on the lateral aspect of the index finger. So this branch is known as the radialis indicis artery. Okay. Then what will happen is that after giving off these two branches, the radial artery is going to continue as the deep palmar arch. So basically, you have two arches on the palmar aspect of the hand. You have the superficial palmar arch formed mainly by the ulnar artery and anastomosis with a branch coming from the radial artery. Then you have the deep palmar arch formed mainly by the radial artery. Okay, so this is the deep palmar arch, which is formed mainly by the radial artery. Then from the deep palmar arch, there are those branches. So those branches are known as the metacarpal palmar arteries, coming from the deep palmar arch. Then after giving off those branches, the deep palmar arch is going to anastomose with that branch coming from the ulnar artery. So that branch from the ulnar artery is the deep ulnar artery, or the deep branch of the ulnar artery. So the deep branch of the ulnar artery is the one that is going to anastomose with the deep palmar arch that is formed mainly by the radial artery. Okay, so you have two arches here. You have the dorsal palmar, you have the superficial palmar arch formed mainly by the ulnar artery. So as you can see, this in red was the superficial palmar arch, which was formed mainly by the ulnar artery, and it anastomosed with a branch coming from the radial artery. Then you have the superficial palmar arch is going to supply the superficial aspect of the hand. Then you're going to have the deep palmar arch, very deep, formed mainly by the radial artery, and it anastomoses with a branch coming from the ulnar artery, the deep branch of the ulnar artery, and that will basically supply the deeper structures of the hand. So that's the arterial supply of the hand. So let's look at the venous drainage of the hand. So when it comes to the venous drainage of the hand, so when you look at the posterior aspect, on the dorsal aspect of that, you have the dorsal venous arch. So you have the dorsal venous arch on the posterior, on the dorsal aspect of the hand. Okay, so main it has tributaries. So these are tributaries coming from the digits. Okay, so this one you can name it as the common dorsal digital vein. Okay, so these tributaries, they are going to drain blood to the dorsal venous arch. And from the dorsal venous arch, what will happen is that on the lateral aspect, it will form the cephalic vein. And on the medial aspect, it forms the basilic vein. Okay, so the cephalic vein passes through the anatomical snuff box. As you can see, those are the boundaries. Some of the boundaries, that's the abductor pollicis longus, the extensor pollicis brevis, and the extensor pollicis longus. So the cephalic vein is one of the contents of the anatomical snuff box, and it's going to be on the lateral aspect, while the basilic vein is going to be on the medial aspect. So the cephalic vein goes on the lateral aspect of the forearm, on the lateral aspect of the arm, and it goes to drain into the axillary vein. So it will pass through the deltopectoral triangle there, it will pierce the clavipectoral fascia, then it will drain into the axillary vein. While the basilic vein goes on the medial aspect of the forearm, the medial aspect of the arm, then it will join the brachial vein to form the axillary vein. So the axillary vein is formed basically by the joining of the basilic vein and the brachial vein, while the cephalic vein goes to drain into the axillary vein itself. So that's basically the venous drainage. So let's look at the cutaneous innervation of the hand. So 3 nerves participate in the cutaneous innervation of the hand. So you have the medial nerve, you have the ulnar nerve, and you have the radial nerve. So when it comes to the palmar aspect, so this is the palmar aspect. The first, second, third, and the lateral half of the 4th digit is innervated by the medial nerve. So this is the medial nerve there. Okay. Then the medial aspect, the little finger and the medial half of the 4th digit is innervated by the ulnar nerve. Okay. So that's on the palmar aspect. So basically you have the medial nerve on the lateral aspect and the ulnar nerve on the medial aspect. Okay. Then when you go to the dorsal aspect of the hand, you're going to have that branch from the radial nerve. So the radial nerve is going to terminate into 2 terminal branches. You're going to have the superficial branch of the radial nerve and the deep branch of the radial nerve, or the posterior interosseous nerve. So the superficial branch of the radial nerve is going to supply the dorsal aspect, the dorsolateral aspect, as you can see there. The thumb, you're going to have the index finger, the middle finger. So the skin is going to be supplied by the superficial branch of the radial nerve. Then the medial aspect is going to be supplied by a branch from the ulnar nerve. Okay. So the ulnar nerve is going to supply the little finger and the medial half of the 4th digit. So that's the cutaneous innervation. So this is where the PowerPoint is ending, and I have less than 10 minutes before this video cuts. So are there any questions based on what I've presented? So you can unmute yourself. Are there any questions before I cut the video?
Yes, sir. I have one question.
Okay.
What's the name of the branch, the first branch of the median nerve, which passes on the top of the flexor retinaculum?
Or the palmar branch. It goes to the palm. So this one, the palmar branch here.
That's the one that supplies the skin.
Yeah, it supplies the skin of the palm there and the skin of the wrist joint there. So basically, when you remember I talked about carpal tunnel syndrome, right?
Right.
Where the median nerve is damaged at the carpal tunnel there, where it's compressed, it can be compressed or it can even be damaged, right? So what will happen is that patient, when they come to the hospital, they'll lose their cutaneous innervation. So they won't be feeling any sensation on the thumb. They won't be feeling any sensation on the index finger and the middle finger, even the lateral half of the 4th digit. But they are going to be feeling the sensation at the wrist joint there and the palm, because that branch is arising before the median nerve goes through the carpal tunnel. You've seen that. Okay. So that's
Yes,
the
sir.
palmar branch of the median nerve. Any other questions? 5 minutes, so I can.
Oh, so
Huh?
did you say the medial nerve is the one which supplies the thumb and index finger?
There's innervation, the cutaneous innervation, yes. So I can just even put on this diagram.
Okay.
So you've seen these branches from the median nerve. They're going to the thumb, they're going to the index finger, the middle finger, and the lateral half of the 4th digit, or the ring finger. You've seen that, right? So these are basically going to supply the skin of those digits, in short, basically. Okay. Okay, so we can end here. I'll send the link to the classroom for the video.